So skin infections are conditions in which harmful microorganisms such as bacteria, viruses, fungi or parasites invade the skin and its underlying tissues. This causes a range of symptoms and complications. So these infections can occur due to various factors, including cuts, wounds, insect bites, or underlying medical conditions that compromise the skin's protective barrier. So common bacterial infections include cellulitis, impetigo, and boils or cysts. Common viral infections include cold sores, chickenpox, and shingles, or warts such as verrucas. Common fungal infections include athlete's foot, ringworm, candidiasis or thrush, and common parasitic infections include scabies or head lice. So common symptoms include redness, swelling, increased heat and pain, and other symptoms include localized itching, discharge or fever. So most skin infections require no treatment and will be managed by the body's own immune system. However, sometimes they require antimicrobial medicines such as antibiotics, antifungals, antiparasitics or antiviral medication. So all infections can lead to fever. However, this is not always a bad thing. This is often an indication that the body's immune system is working properly. However, if the fever is above 38 degrees, is unresponsive to paracetamol, or you feel generally unwell, urgent medical attention is advisable. Yes, many skin infections can be contagious, meaning that they can be spread from person to person through direct or indirect contact. The contagiousness of a skin infection depends on the specific type of infection and how it is transmitted. So it depends on the severity of the infection. Antibiotics will only work against bacterial infections. If your infection is caused by another organism, antibiotics won't work. This is why you may not always be prescribed antibiotics for a skin infection. So a blood test is generally not the primary diagnostic tool for identifying skin infections. In most cases, skin infections are diagnosed based on clinical evaluation, symptoms and physical examination by a healthcare professional. Sometimes, however, swabs are taken to confirm the cause. Unfortunately, yes, people with diabetes are at an increased risk of developing skin infections, and this is due to several factors. Diabetes can weaken the immune system's ability to fight off infections, including those affecting the skin. Diabetes can also lead to poor blood circulation, which can hinder the body's ability to deliver essential nutrients and oxygen to the skin. As a result, even minor injuries or wounds may take longer to heal, making the skin more susceptible to infection. Also, elevated blood sugar levels can also provide a favorable environment for bacteria and fungi to grow. Yes, there are several signs that a skin infection may have become worse or is not responding to treatment as expected. These include increased reddening, heat or swelling to the area, including pus, discharge or a foul smell. Tissue within the wound may also become darkened or black as the cells die, and this is a serious complication. In severe cases, you may develop a high temperature or feel very dizzy, confused and generally unwell. And in these circumstances, it is important to seek urgent medical attention. So itching of the skin, also known as pruritus, is a common symptom that can have various underlying causes. It can sometimes be caused by skin infections, but can also be caused by conditions such as eczema or dermatitis, dry skin, allergic reactions to soaps, washing powders, medicines, insect bites, and even healing wounds can cause the skin to itch. Skin infections during pregnancy can be a concern, as the impact and seriousness of the infection can vary depending on the specific type of infection, the stage of the pregnancy, and the overall health of the individual. In general, it's important for pregnant patients to seek medical advice if they suspect a skin infection or experience symptoms, as some treatments may need to be adjusted to account for the pregnancy. So infections on certain areas of the body, like the face, can be of particular concern because of the potential for complications affecting vision, breathing, or cosmetic scarring. Infections near joints can be worrisome due to the risk of joint damage. However, the seriousness of any skin infection depends on various factors, including the type of infection, the overall health of the affected individual, and the timeliness of medical intervention. Differentiating between a skin infection and a rash can sometimes be challenging, as both can present with similar visual symptoms such as redness, itching, and skin changes. Rashes are generally non-contagious and less infectious in origin and may be easily identifiable by their pattern. If in any doubt, a healthcare professional can usually provide a proper diagnosis and recommend appropriate treatment or management. While allergic reactions can cause skin issues, these reactions are not infections. Skin reactions due to allergies are primarily inflammatory responses by the immune system. They can cause symptoms like redness, itching, swelling, or rash, but they are not caused by infections like bacteria or fungi. The duration of a skin infection can vary widely depending on several factors, including the type of infection, its severity, and how promptly it's treated. Some infections may start to resolve after a few days, while others may take several weeks to clear up.